generation here in Hamilton with McMaster University.
McMaster University, right?
And the gentleman, the doctor that I had the extreme pleasure of meeting, and who is still a good friend of mine, was Dr. Michel Rathbone. He's a professor. And prior to that, I had done contract work through rel-mar. And one of the contracts I did was the Director of Communications for the SPCA. Now, if I wanted to raise hundreds of thousands of dollars for a little puppy that needed an operation, all I had to do is go on TV, show the puppy, and the money would flow.
Exactly.
Now, try and get money for a human?
It just won't work, will it?
Here we have a doctor and his staff who are working on getting people who have had severe spinal trauma to get the spine the spinal cord working again, to get these people to walk and to have good lives. Do you think
some sort of function?
Yeah.
I mean, we're talking about a human life. And bringing some fulfillment to a person who's had a very tragic, situation. Oh, yeah.
And it's very hard. And then when you start learning about the cost of medical trials and how the medical trial systems work and how you have to have the different tests, it's a wonder that we have gotten so far with medical research based on the amount of work and dedication that has to go into every single project. But my whole thing was, I could raise hundreds of thousands of dollars for a puppy, but I couldn't for a human.
Right. And it's just maybe a sign of our times, perhaps it's just human nature, looking at this poor little innocent creature that needs help, and it just strikes a chord with a lot of people. But I'm with you. I think it's nice if we could take care of the puppy and we could take care of humans, and make sure that we get everybody situated so they can have a fulfilling life to the degree possible given the circumstances. Absolutely.
Let me ask you this, Dr. Z. What are some of the similar problems that can be confused with Meniere's? That's
very critical to know, and I'll tell you why. And I want to back up just a second, that if any of your listeners are having any of these symptoms, they really should be seen by a provider, by a physician. And I appreciated you saying that earlier at the beginning of the show. Very important, because many times it can be simple innocuous types of things that make somebody have dizzy episodes or spinning episodes. Yeah. Medications are very common. There's also something called benign positional vertigo, which is sort of a non-sinister sort of just dizziness that just comes in attacks or comes in episodes. And so there's a lot of that, and that's probably those. The simple things are the most common. However, we have to be careful about that other few percentage of disorders that can be involved. And so, stroke was one of the ones that you had mentioned, and there are all kinds of unusual symptoms when people are beginning to have a cerebrovascular accident or CVA or a stroke. And, that needs immediate attention.
Sure does.
Even if you kind of think it's a stroke, maybe sort of get to, do like you do, call
seconds matter.
Emergency services. Seconds can matter.
Yeah.
Also, too, brain tumors, multiple sclerosis. There can be cardiovascular disease going on. So I always tell people that if you've got some spinning sensations or vertigo, you're having episodes, and if it's accompanied by things like a headache that's very unusual or severe, or double vision, if your speech is becoming impaired, you've got weakness, you're going in and out of consciousness, having trouble walking, falling, feeling numbness, tingling, chest pain, shortness of breath, anything like that, get in, get evaluated. Much better to have somebody tell you, oh, you're just having an anxiety attack, versus, wow, you didn't go in and you were actually having a stroke and now you got a big mess on your hands.
How can someone with Meniere's or a loved one with Meniere's, cope with this horrid disease?
And I think that question gets to the heart of a lot of these chronic and even somewhat mysterious conditions. Very important to be able to cope with it. Now, we have to back up and say there's not a cure for this. So there's not a pill that one can take or a magic wand or something that will make it all go away. There are some medical treatments that can be used. For example, they can inject certain medicines into the middle ear that will deaden the balancing function on the one side, so the other side takes over, and it sort of keeps the vertigo from occurring. There's steroid medications, there's hearing aids, there's all kinds of things that can be done. So those are absolutely critical to talk with your physician about and decide which of those might be appropriate. In a more extreme case, there's surgery where, in the most extreme case, they actually take the inner ear portion out, or parts of it out, but that's getting pretty extreme. So I like to look at more of the lifestyle kinds of things that people can do to cope with this condition. In other words, if you've talked to your physician, you've got a medical plan, the disastrous sorts of things have been ruled out. Okay, now how can we make our life a little more comfortable? What can we do? So several things that I think are important. Number one, when you're having a dizzy episode like this, very important to sit or lie down. So, you want to manage, all of that. Try not to do things that might make the symptoms worse, like, moving suddenly or sitting with a bright light in your face or watching television or trying to read, anything like that. Also, rest during and after the attacks. So try to just kind of take it easy for a little bit. Let the system calm down. As well, be careful about falling. Don't do anything like that. Don't drive a car, operate heavy machinery that might cause problems. There are also some dietary changes.
All right, let's talk about the diet when we come back, Dr. Z, because I have to take my news break, my friend. Exonation, Dr. Z is our special guest, www.livingwhole.livingwell.com, and we'll be back on the other side of this commercial break with the news. My name is Rob McConnell. This is the X Zone. Don't go away. Are you considering calling a psychic to read your situation? Then consider David Champion, a psychic medium for more than 20 years with thousands of readings under his belt. David Champion will make you feel comfortable. He has proven to be honest and accurate. He's a straight shooter. There's no guesswork. What he sees is what you get. While he is a medium, most of the calls focus on relationships, not only love, but work, school, neighbors, and more. Need help with finding a job and preparing for the interview? Are you dealing with people who are obstacles in your path? For more information, go to davidchampion.com, $1.50 per minute paid by credit card with a minimum of 30 minutes. For your reading with David Champion, call 1-877-702-8598. That's 1-877-702-8598. Now you can dial in to listen to the X Zone radio show from anywhere in the world with Rob McConnell 24/7, 365 by dialing 213-401-0080. That's 213-401-0080. If you have a mobile phone or landline, the X Zone radio show with Rob McConnell is now at your beck and call at 213-401-0080. That's 213-401-0080, 24/7, 365.
Hi, this is Elizabeth Joyce with Stargazing for the X Zone for the week of April 28th. The sun will look like a ring of fire above some remote parts of the southern hemisphere on Tuesday during a solar eclipse, but most people around the world won't get a chance to see it. Whereas lunar eclipses occur when there's a full moon, the solar eclipse only happens during a new moon. Half the world saw the blood moon lunar eclipse during the full moon of April 15th. Tuesday's eclipse will occur when the moon is closest to its farthest distance from the Earth, making it too small to cover the sun completely. The resulting effect looks like a ring of fire called an annulus, and that appears as a silhouette around the moon. Remember, when there's a new moon, there's no moon at all. The worldly application of a Taurus solar eclipse is to help you get in touch with your core values. It blocks out personal ego desires to go right to what your inner spirit wants to manifest. The opportunity is to bring higher values and greater beauty into your life now. The new moon and solar eclipse on Tuesday may send the world into a mild tizzy. Watch North Korea and the Ukraine for major upsets with government. But you will get another opportunity to consolidate whatever advantages you have gained over the past few months. A Taurus new moon is excellent for putting practical effort into your needs and desires. Health and wellness options get a boost early in the week, perhaps prompting you to consider a new diet or exercise routine. There's also positive news on the work front, as changes can mean a boost in earnings or a promotion. If you've been applying for a new job, you may get some good news. Later, Venus glides into Aries, which brings romance and pleasure. Look, your love life is looking much livelier. Enjoy a few social outings. It might help take your mind off some more stressful matters. Perhaps you want to make some changes in your home, new furniture, paint, whatever. Whatever comes your way, you'll probably put a lot of energy into it, so focus and accomplish what you want. Because there's lots of planets in unmovable signs, Taurus and Scorpio, as May opens on Thursday, be careful of stubborn my way or the highway thinking. Warrior Mars is still retrograde until May 19th. Consider what is dead in your life and needs to be released. Know that your highest path is shown if you go into your inner self to seek direction. Continue with hard work early in the week, and then make time for a variety of fun as the month of April ends under a Gemini moon. Gemini wants to keep things on the move, talk to a lot of people, and does not get bogged down in any one thing. Enjoy May Day and the Kentucky Derby on Sunday. Time to plan for some summer fun.
And for more information, you can contact Elizabeth Joyce for a one-on-one private consultation by visiting her website at www.new-visions.com. She does one-on-one consultations worldwide via Skype. Once again, www.new-visions.com. Dr. Z is our special guest. Dr. George Zgourides is his name. His website is www.livingwhole.livingwell.com. First of all, Dr. Z, always great having you on the show. Thank you very much for taking time out of your busy schedule to come on tonight to talk to us about Meniere's disease and Morgellons. Now, before we went to the news break, we were just going to start talking about how diet affects certain ailments. And I was wondering if you can just continue on that before we switch over to Morgellons.
Sure. And again, it's a pleasure being on with you, and thanks for having me. We went through a couple of things people can do to cope with Meniere's, like, sitting down, resting, not doing things that might cause an injury. Now, diet's interesting because in this condition, there seems to be this excessive fluid inside the ear. And so, one of the medical treatments is to prescribe a diuretic, which helps, it's kind of like a water pill, helps get rid of extra fluid. So, what you might be able to do sometimes, in some cases, is limit salt, for example, in the diet, which will help reduce fluid retention, okay, and that which in turn, overall fluid retention, which in turn decreases fluid in the inner ear. I think, too, it's important to eat regularly. I always recommend some, 5 or 6 smaller snacks or smaller meals rather than the big, three meals a day. Also, a lot of patients respond well to avoiding MSG, monosodium glutamate, which comes in a lot of prepackaged food products and a lot of restaurant food. So that particular chemical tends to worsen fluid retention, which can then worsen the condition of Meniere's or actually trigger attacks. So you got to watch it. So sometimes, and we were talking about identifying triggers earlier, sometimes the main trigger is eating out Chinese food, for example. So you have to kind of keep an eye on all of that. A couple other things. Avoid caffeine in many instances. That seems to make the ringing in the ear better. So caffeine will often make it worse. You want to limit the caffeine, avoid